First, good morning to all, and a warm welcome to our third webinar and last one before the summer break. I am Marie-Christine Bonamont, the Secretary General of Public Safety Communication Europe. So today we are going to discuss what were some, of course, because we cannot cover them all, some of the challenges encountered by European PPDR organization in managing the COVID-19 crisis. First, I would like to start with a few words about PSCE for those of you who do not know the organization. So the forum is gathering three communities. We have practitioners, which could be Ministry of Interior, Civil Protection Organization, and volunteer organizations like Red Cross. We've got industry and research, so technical institutes, university. Our aims are to define roadmaps and policies for the evolution of public safety, communication and communication systems, and to stimulate a continuous dialogue among our three communities, to shape this dialogue and to try to answer some questions. What are the needs of the practitioners? What are their requirements? What are the solutions already existing? But also, what could be the solution in the future? And what research should look at? If we go now into the topic of today, we could try to start with the definition. There are multiple definitions of a crisis. I took one from the ISO standards on security and resilience. A crisis is an unstable condition involving and impeding abrupt or significant change that requires urgent attention and action to protect life, assets, property, or the environment. The COVID-19 is a global crisis. I mean, it does not concern only a region or a country or Europe, but it's worldwide. Maybe we could have predicted such a pandemic, but maybe not its magnitude. We have a series of domino effects that have impacted the whole organization of our society. Today, as I said, we cannot cover all aspects, but we will focus on three domains. How public warning system can support crisis communication, the management of communication the communication overload in 112 center during the peak of the crisis, and also the management of logistics for providing to first responder the necessary equipment. It was mainly protective equipment, but also testing equipment during the crisis. It is maybe too early to speak about lessons learned, but at least we could try to share experiences, and it's a good starting point. How the PPDR organization have faced this unprecedented experience, how did they manage, what were the problems, and how did they adapt to these challenges. So before giving the floor to Koen, I would like to briefly introduce our three speakers and experts of today. So we'll have as first speaker Koen de Boet. He's working at the Belgium Crisis Center at the Ministry of Interior. He's the coordinator of the Higher Institute of Emergency Planning. We will have then Fernando Conde. He's the coordinator of operations at the Madrid 112 Center. He has huge experience in the management of operational procedure for 112 Integrated Center. And we'll finish our webinar with our third speaker, Mr. Theo Liggins. He's the head of logistics for international operation at the German Federal Agency for Technical Relief, THW. Before giving the floor to Koen, I would like to give you a few rules for our webinar. So now you are all muted during the presentation. We have more than 130 registrants for today's webinar. There will be some possibility to ask questions, of course. So you will see the chat option when you can ask your question. And after each presentation, I will pick up 1 or 2 questions because we are limited in time, of course, so that our speaker could answer these questions. And shortly after the webinar, the video will be made available on our website, but you will receive also a notification for that. So I will give now the floor to Koen.
Okay, thank you very much. Good morning to everyone. If all goes well, you can see my screen right now and you can hear me. Okay.
Yes.
My name is Koen de Butte. I work for the Belgian National Crisis Center. As you may imagine, the Belgian National Crisis Center was actively involved in the crisis management of this COVID-19 crisis, and is also responsible for the crisis communication in Belgium. Today I will only be talking from my perspective, which is a perspective of the responsible for the public alert, the public warning system in Belgium. During this crisis, this COVID-19 crisis, we were asked with our Be Alert platform, because that's the platform, the public warning system we have in Belgium, we were asked to give a support to the crisis communication. And I'm going to talk about the way we did it and the way we experienced it in the last few weeks. So first of all, I'm going to introduce you what is Be Alert exactly, what do we do, how do we work. Then I'll be talking very briefly about the expectations from perspective of crisis communication towards Be Alert. You've got mail. You will see that during the last weeks we sent out a record of emails. In doing so, we faced some huge challenges we had never seen before, and we received some reactions of the public as well, as you may imagine. To conclude, I'll try to come up with some lessons learned. First of all, let me briefly show you what is Be Alert all about. Be Alert is a public warning system which is used in Belgium by the authorities who are responsible for warning the public. This means that the platform can be activated on 3 levels. On a local level, by the mayor, on a provincial level, and on a federal level by the crisis center, which is ourselves. Within this platform, we have several technical channels, several technologies we can use in order to warn the public, such as SMS, email, spoken messages, social media. And they can be sent out in several ways. The first main channel or main exit we have from Be Alert is towards citizen subscriptions. We have thousands of citizens subscriptions for Be Alert, and this is a channel we use next to the localized SMS channel. So we have the possibility not to work with subscriptions, but to reach everyone in a specific zone based on localized SMS. and currently we're also working of complementary technologies by making use of the CAP protocol and working with several APIs. During this COVID-19 communication, it became quickly clear that BeAlert could play an important role to support the crisis communication, and we did so, and the expectations were that BeAlert could distribute accurate and validated information. As a matter of fact, it was always very easy to get information. Newspapers were really quick to pick up the specific measures, social media as well. But this was not always validated information. So that's an added value we could offer with BeAlert and the Crisis Center. We can distribute accurate and validated information. It was also expected that BeAlert could complement spoken communication, such as the official press conferences, with written communication, which can be read and reread and spread very widely. We wanted also to inform the public on the measures taken, but not only on a national level, but also on a local level. It was possible that on a local level, it was necessary, for example, to send more precisions. And then lastly, we were asked not to send out any disproportionate communication. This means that as we look at the picture, BeAlert was mainly asked to send out emails, and we send out the emails to all citizens registered on BeAlert. So during this support we gave for the crisis communication for this COVID-19 crisis, we did not make use of our localized SMS channel, nor did we make use of the complementary channels by using the CAP protocol. So this question to start sending out mails in a normal constellation, let's say, BeAlert can easily handle the everyday crisis we manage, such as a huge fire in a municipality or a city, and then we see a lot of SMSs sent, sometimes complemented by emails. So we were a bit taken by surprise when halfway March we got a question to start sending out emails in support of the official press conferences, which meant that we would have to send out hundreds of thousands of emails at the same time. So this situation, I must say, we had tested it before several times in our testing strategy we have for BeAlert, but in an operational situation, we have never made use of this email channel on such a large scale. So somewhere between half March and the end of June, we were asked to send out 10 national campaigns in follow-up of the official press conferences. And in total, we sent out more than 7 million of emails to registered BeAlert citizens on a federal level. On top of that, as you may see, we had more than 165 BeAlert campaigns initiated on a local level, and this amounted also to 300,000 of emails, but also 50,000 SMS and 13,000 spoken messages. In the center of the slide, you see an example of the emails, one of the emails we sent out on a federal BeAlert campaign. Once we started sending out such a huge amount of emails, we soon faced several challenges. Mostly technical challenges. So one of the first campaigns we ran into the problem or issues of capacities and the speed of sending. Fortunately, we could send out this email campaign in the evening. So it's no problem. There was a lower use of the platform BeAlert, and it was not necessary to come up with a very urgent message. It was more important to come up with an accurate and validated message. So we had the time to send our emails in the first campaigns, but after the first campaign, we knew that we would have to improve a lot on this speed of sending. That's why we worked together with our supplier to raise the speed of sending very quickly. So we had to come up with a kind of scalable solution. Once you can send out hundreds of thousands of emails together at a time, we run into, well, you always go into the risk of a bad spam reputation. We were very lucky that we had constructive partners in, for example, Microsoft or Google, to come with a better spam rating than this risky bad spam reputation. So that's an issue we ran into once we started sending a huge amount of emails. As we make use with BeAlert of a subscription website where citizens can register themselves, we faced some unexpected subscription peaks. In the graph, you see, for example, the blue line below is the normal everyday traffic of our subscription website. So it's very low, even in times of a heightened risk. But the peak you suddenly see around 12 o'clock was after the official press conference, where our communication officer mentioned BeAlert as a channel to reach everyone with the COVID-19 measures. And there you saw that within half an hour, we had a peak of 18,000 hits on our subscription website. So if you're unprepared for such a peak, then of course your subscription website goes down. Which briefly it did. So luckily we were prepared for that, and we could work on quick solutions for getting the website up and running. And then our last challenge we faced also with BeAlert, we were just the platform to send out the messages, was how to deal with replies. Normally, we well, we sent out our messages with a no reply address. So it was supposed to be clear that citizens could not react to Be Alert. But in practice, people did find our coordinates on the Be Alert website, for example, or on social media, and we got feedback we had to get structured. As a result of our national campaigns we sent out, we saw from the beginning of March until mid-May a raise in our Be Alert subscriptions with 20%, which is huge. So now we're at 880,000 Be Alert subscriptions in Belgium. And the other raises we saw were mainly local. For example, after a huge fire in a city, or well, a flooding somewhere in a region, then you could notice in that region or in that city a raise of Be Alert subscriptions. But on the whole, we could not see this in our curve of subscriptions. For this COVID-19, the crisis communication, things were very different, and we saw a rise, a sharp rise of 20% in the overall amount of subscriptions. As I told you, we received some reactions, mainly by email or on social media. Here I try to give 4 representative reactions of the public, and well, as you may imagine, everyone received a lot of reactions on how they were doing managing the crisis or not. These reactions I show here are really targeted at Be Alert. It are reactions to the Be Alert campaigns we sent out. And there we saw in green that most of the reactions are positive. People really value the fact that the campaigns were reliable. You knew when to expect them after each official press conference by the government. They are concise, they are on time, easily accessible through email. It is a channel which is easily accessible. It's not like, for example, an app which has to be downloaded. So email was clearly the right channel, was our conclusion. In red, we had a more negative criticism, but when you read the text, it's in Dutch, but when you read the reaction, most of the negative criticism on the Be Alert campaigns was targeted not so much at the form, but at the contents of the message. And the contents of the message, that's not up to Team Be Alert, nor always to the crisis center. So the contents of the message were mainly well, decided on a political level. We've tried to look at some conclusions, and there are conclusions from the Be Alert perspective, which means we tried not to come up with conclusions on how Belgium managed the situation, but on what have we done well or not well from the Be Alert side. One of the conclusions was that we were once again very happy with the multi-channel approach we have chosen some years ago. we have examples of public warning systems mainly focusing on one technology, such as an app, for example, or SMS or cell broadcast. We, from our Belgian perspective, we think that it is necessary to combine all of these channels. Once again, with this COVID-19 communication, we saw that it gave an added value to be possible to send out by email. I would say also look for strategic partnerships on all levels, which means not only politically, but also the technological support. So we were very happy with the supplier who was flexible, and who could look for solutions for the problems we faced together with us all time of the day. So here's perhaps a suggestion for all of the industry's representatives. Don't only focus on your product or on the technology, but also try to focus on the user and the support you give him. And strategic partnerships on all levels, also in terms of corporate responsibility. We were very happy to see that big companies such as Microsoft or Google were really helpful to help out with sending out such a mass of emails without running into trouble in terms of spam reputation. Try to invest in support for your citizens, but don't forget that you have users as well for your public warning system. So it's not only the public who wants a clear message, but also your users. Can we make use of it? What are the good experiences you have? How do we do this or that? So there are these two sides in giving support. And then lastly, that's a classic point I always try to highlight. Don't be afraid to use your public warning system and put forward your successes, but do it without forgetting what can and should be better next time. So we're also thinking about a more in-depth analysis of how we did and how we can do better next time. So that's all for our Be Alert perspective for now, and I'll be glad to take your questions.
Thank you, Koen, for this very detailed presentation. We're a bit running out of time. I think you answered in your presentation already some of the questions about the number of subscriptions. I will have one or two questions very rapidly. What is the number of staff that is normally operating Be Alert? And did you have to have extra people during this period to run the system? And also, you mentioned that you did some SMS at national level, but also locally. So what was the situation where you had to do these local alerts?
Well, our staff is we're a crew of 5 persons, and it was not necessary to make it a bigger team. But it is important to bear in mind that we don't do all the sending of all the campaigns ourselves. We sent out on a federal level ourselves, but all of the 165 campaigns were initiated at a local level by municipalities themselves. And most of the campaigns on local level were concerned, for example, of services who could open or not open, distribution of mouth masks, for example, precisions on schools. So really local communications.
Okay, thank you a lot. Maybe we'll go through the other question later on. So if you can answer them, we will be pleased to circulate.
Yeah.
So now we can move to the next speaker. Fernando, the floor is yours.
Hello. Good morning for everybody. Thank you very much to PSCE Europe for giving me the opportunity of sharing with you some of the challenges we face in Madrid 112 in the coronavirus crisis. Perfect. As is stated in the title of my presentation, I will try to give you the perspective of how my emergency center managed information overload, sharing with you our learned lessons about COVID-19 crisis. Let me start by reminding you that the 112 service in Spain is decentralized and attributed to the autonomous communities and autonomous cities, so that we have 19 112 services depending on their autonomous governments. There is no state-level 112 service in Spain. So, Madrid 112 responds to the territory of the Community of Madrid, 179 municipalities, including the capital city, more than 6.4 million inhabitants, and before the crisis, around 9 million visitors per year. When the outbreak reached our region, the first challenge that Madrid 112 was up against was a huge increase in emergency calls. Our daily incoming call average during 2019 and early 2020 were 12,400 calls per day. As a reference, the graphic shows the emergency calls received in March of 2019. In March of 2020, we went from 11,000 calls on day 1 up to 27,500 calls on day 12. It is more than double. Obviously, our PSAP is designed and prepared to answer large numbers of calls when a major emergency occurs, but normally the number of incoming calls drops rapidly due to, I like to say, the blue lights effect. That is to say, when people see the first responder at the scene, the emergency calls are reduced. But that didn't happen in this case. At this effect, the coronavirus crisis is being an invisible response. Of course, our emergency center has a mechanism to reinforce the number of emergency operators, but it was dimensioned for a limited time. For example, we hope to use it 1 day for a plane crash, 3 days for a forest fire, 1 week for a flood, etc. But this crisis did not seem to have an end in the short term. Fortunately, the trend changed in the middle of the month with the declaration of the alarm state by the state government and with an advertising campaign to tell the population to use the 112 for emergency only. In this crisis, we apply the lesson learned in the past, and from the beginning, we public and support an alternative free telephone number to do questions about the coronavirus. The welcome message in the 112 line was changed to invite to the callers looking for COVID-19 information to use the another specific number. This helped a lot to dedicate the 112 for emergencies only. Once again, one of the challenges was to keep the answer time as low as possible to maintain the quality of the service for all kinds of emergencies. Incoming emergency calls are automatically queued, waiting to be answered. One of the tools we use to improve the queue management in this crisis was an interactive vocal response system, IVR. Before a human operator could speak with a caller, this machine asks them if their emergency is life-threatening. An affirmative answer changes the order of this call inside of the queue and raises its priority level. In this way, we try to avoid possible loss of life due to waiting time. In a near future, we would like to improve this system using natural language recognition and artificial intelligence techniques. One of the risks that we were concerned about was the possibility that our own personnel or their relatives could be infected by COVID-19, and so the number of emergency managers at the operating room would be under 50% of the normal shift. This is a graphic view of outbreak spreading showed by our big data tool. In this pandemic situation, to request aid to another emergency center did not seem possible because the situation was similar for all. In any case, we needed reinforcement. The solution was to immediately hire non-emergency operators in the private sector and training them in record time. Let me say that the normal training for our emergency operators takes 150 hours, and that we did not have that amount of time at the time. Also, our training room holds 10 positions to work simultaneously at once with up to 20 persons, but for safety reasons, to maintain a safe distance among learners, the maximum capacity was limited to 6. In that way, this room we could not use efficiently. So that the incorporation of this new force led us to the second challenge, to train the new team as soon as possible, under safe conditions, and without disturbing the normal operation in course. The solution implemented was to use the backup center that we have as a training room during a few days. As a mission-critical service, Madrid 112 has a second center 5 kilometers away from the main center as a redundance capability, and it is working round the clock 7 days a week as a high availability measure, but without human presence. The design of this backup room with 40 positions allowed us to use half of those positions for training purpose and for operating as reinforced center after that. We would have a week only for this special training course, and to give them a deep knowledge about 100 operational procedures would be impossible at this time. So it was necessary to design a COVID-19 special procedure to reduce the training time. Besides, under training point of view, the most of COVID-19 incidents was at home, where the difficulties for locating the emergency are less than in open areas or roads. Luckily, the infected rate among our personnel has been very low. The ergonomic design of our operating room, with important distances among positions, as you can see in the picture, was one of the key factors. Once the inputs were controlled, the next challenge was to assure that emergency information spread smoothly among emergency agencies. We are connected by telematic media with the most of the agencies, and in normal time, it's not usual to dispatch more than a few hundreds of incidents per day to some agency. In this crisis, with the health system totally busy, the impossibility of the medical service to deal with a huge amount of cases threatened our technical platform to collapse, with more than 9,000 incident queued in its inbox. Once again, it was necessary to create a new cross-sectional procedure between 112 and the medical authority to keep this queue under control. As I said before, Madrid 112 Center has redundancy in all of its critical systems so that we use different technologies to do the same things to ensure that always one of them is available. To cover the possibility of a telephone blackout, we had rolled out a digital radio network to connect the main command and control rooms in the region. But this crisis brought about a new necessity, the video conferences. Logically, our crisis area was prepared for it from before the crisis, but always thinking in one video conference at a time. The impossibility for authorities to meet each other in person increased the number of video conferences, doing up to 3 simultaneously a lot of days. For that, it was necessary to look for more places to use as meeting room to ensure wireless coverage and bandwidth enough to the required quality of service. Of course, also it was necessary to dedicate more informatic technicians as support staff. By last, we needed to preserve the organization core. Only a few people formed the technical team that ensured that the complex technical platform of Madrid 112 worked properly, and it was a critical matter to maintain them safe and available. Administrators of databases, communication, procedures, geographical information system, and other technicians started to work virtually from their homes. In the picture, myself at home. Until the crisis exploded, our telematic network was totally closed to the outside. Only the remote terminals rolled out in the emergency and safety agencies could connect with the emergency center. And now we needed to open this network for virtual working. This last challenge was to create the necessary cybersecurity condition to do the work without putting at risk the operations. In summary, the challenges Madrid 112 faced with were to maintain the answer time as low as possible during the crisis, to increase what are risks to keep their capability of response with resources enough, to control the information flow with the health authority under control, to offer to the government members involved in the crisis the best condition to virtual meeting when they need it, and to preserve the organization core with virtual working. Thank you very much. I wait for your question.
Fernando, I have one question for you, because it seems that you have been very flexible and you adapted well to the situation. Do you think that some of the new procedures that you experienced, like the virtual working, you will continue to keep that even after the crisis? So will it change? Will it have an impact after?
We have an advantage, that is, we are the properties of the main tower here in our center. We use a computer-aided dispatch designed by our team and developed for us. The code is property of the regional government. So we have a lot of control for this software, and that let us to change the procedure, the parameter, all the question we need to change in a dynamic way all the operation in a moment. And this crisis put to approve this possibility. So in a few hours, when not in a few minutes, we can create a cross-sectional procedure or change the message in the welcome line when the caller is waiting for a human operator, and that is very, very useful. Normally, we don't maintain this change more time than necessary. So we are disconnected now this new procedure and new message, waiting for a possible second wave of the outbreak.
Okay. Okay. Thanks a lot for the presentation. And so now we can give the floor to our last speaker from THW from Germany.
Hello, everybody. You can hear me? Yeah, seems so. Good afternoon or good morning. Yeah, the German Federal Agency for Technical Relief has normally not a really big part in medical situation, but on this situation we have been a lot of work done in the logistics, in the part of logistics. I will start with the presentation now. Wait a second. So. One second, it's still loading. So. Yes. I think you see everybody see it. Yeah, THW is the German Federal Agency for Technical Relief, a volunteer-based organization, and this is our big advantage on this situation. The main field activities, what we did in logistics, was distribution and transportation of personal protection equipment, but also disinfection and transportation of medical equipment. Special on request of our lenders. Germany, you know, has this 16 lenders, and the Federal Agency for Technical Relief is represented in every of these lenders, but the responsibility for the supporting of the population is by the lender, or is organized by the lenders. But our structure has been not designed for this, and we have to involve them. For example, we have installed a coordination group for logistics. We have some distribution center installed, for example, in Munich, for the government of Bavaria, and distributed from there to the population of Germany, the PPE. So, but I will continue. Yes, THW has been tasked by the German government, especially by the Coordination Center or Crisis Center of the Ministry of Health and the Ministry of Interior, to install a so-called Center for Coordination of Logistics. This has been, it's only a coordination body, and has been the linkage between the distribution or the organization. No, one before, please. So this one. The linkage between the organizations of the German government who were producing the PPEs and the distribution to the ministries. There was two parts. There is one distribution part to the population and the health system, has been done by a forward agent until the lenders has been reached. And on the second part, and this was the main part of THW as well, was the coordination of the PPE, what has been allocated to the ministries, for example, the federal police, the customs, but all the Ministry of Health, what they need to work in a safe environment. The next, please. Yes, we got our equipment from, or the equipment what we have distributed via our logistics centers from several forwarders, and we have until now, and this is amazing number, it's 45 million of PPE. it's for example, FFP2 masks, it's gloves, it's shields for the face, and so on and so on. And until now, 430,000 liter of disinfection, up to 100 destinations. And yeah, the challenges on this was the PPE was not always has not always meet the quality standards, and then we have to find out who was the organization or the company who has delivered them, and we have to give it back to the Ministry of Health to get the certificate of this. Can you do the next slide, please? Then every day we had changing of volumes and items. This was also a challenge. And this is still a challenge, and we are still working on it. It's that we are still in the process of distribution of PPE to the ministries, but most of the ministries and the official governments in Germany are not able to get such an amount of PPE and to store this. Now we have to find solutions how we can get this process a little bit smoother. The advantage of the THW coordination was, and this is my experience, and I believe on it, is that we have a short communication with all the ministries and departments who received the PPE. We combined the utilization of commercial transport and what has been necessary, for example, with THW vehicles. You see it on this slide in one of the pictures. And as well, and this is the most advantage, the flexibility about the volunteers what we have, and this is the main focus on it, that the volunteers are part of the community and they are known. And this is also, if we deliver things, we are recognized, and this is really an advantage. But, and this is not over, and this is the main thing, what I see, it will be a longer distance to provide PPEs to the population, but as well to the ministries for the next future. And my personal lessons learned is we should, and this is what I think, what my colleagues also think, so it's, if we train this in advance, and it's nothing ad hoc basis to build up new structures, and therefore we have to think about this for the future. And this is one of my lessons learned, that we, especially in logistics, that we have better solutions on our desk to get them really quick implemented. That's all my part. Thank you very much. Now I'm open for question.
Thank you, Theo. I have one or two questions for you, because you were mentioning that you were delivering this equipment to the ministry. The equipment to the hospital were distributed not by you, but in other ways?
It depends. It depends on the government of the Länder. For example, what I said before in Bavaria or in Schleswig-Holstein, the responsibility is by the Länder, and they ask THW for support to distribute them to the hospitals, but as well to the medical centers. But this is the responsibility of the Länder, who got this on a main point of entrance, and then they ask THW to distribute this in other Länders of Germany. Okay.
And then I have also another question about possible cross-border cooperation or delivery of equipment outside of EU. So is THW also was involved in operation to deliver some equipment to some neighboring countries to help them?
To be honest, not really. We have contacts to them, but on this stage there was no request to get to support them, and the other request was that we have to deliver this for the population inside of Germany, and then what we have seen that the PPE was really a challenge, and the borders have been closed. But for example, there was in February or March, there was an earthquake in Croatia, but we were not delivering PPE, but we were delivering other support equipment to Croatia.
Yeah, so you still go on with your normal duties to deliver some other equipment. Yes.
Yeah. One of the duties of THW is civil protection, and also on missions abroad, but this missions abroad has been requested then by the federal government, mainly by the Foreign Office or by the EU.
Okay, thank you. So I will check if there was other questions. And yes, for me, because you were mentioning a very large pool of volunteers within your organization, which is impressive. But with this task, was it feasible to cover the speed and for the delivery of the equipment with your number of volunteers?
Yes, we increased things, and this is one. I will tell you one example. There was one, we received PPE masks, FFP2 masks from the warehouse of the Ministry of Health. This was on Wednesday morning, and on the Thursday morning, we delivered everything to several ministries. That means it came from there to our logistics center in nearby Düsseldorf. Then we have distributed it, or we have prepared it for the distribution, and on the next morning it has been in the ministries. And this is sometimes a little bit faster than commercial companies to distribute it. And this is one of the really advantage that we have the volunteers to speed up processes.
Okay. Yeah. Okay. Very good. And then there is one question I see. So who set the priority for the distribution of the PPE? So if you were receiving the PPE, how to distribute them and to whom?
The crisis center of the Ministry of Health and the Ministry of Interior. We got the priorities, and with these priorities we worked.
Okay.
It was not our task to set priorities, but the priorities has been set by the crisis center.
Okay. So thank you for this. I do not see any more question about the logistic, but I see that the chat is functioning well, that Fernando is answering online also some questions about IGR and the 112 Madrid. As I said at the beginning, you will soon all receive the link to the recording of this webinar. And I would like to wish you all a very good day and a good continuation in the preparation and on the fight against this crisis, because we might have to face new waves of the crisis. So thank you all for taking the time to share with us your experience. Thanks a lot, and goodbye. Bye-bye.
Bye-bye.